Good day, I'm student nurse Maria and I will be preparing injections for intramuscular, subcutaneous, and intradermal injections. So first we need to review order including name and medication, name, dose, route of administration, and time of administration. Next is to review pertinent information related to medication including action, purpose, side effects, and nursing implication. Next is to check date of expiration for medication, vial, or ampule. Next is to assess client's body fluid, muscle size, and weight. And next is to wash hands. Assuming that I have already washed my hands, next is to prepare the medication. So I have here all my medication needed. First, for the ampule preparation, top of ampule lightly and quickly with finger until fluid moves from neck of the ampule. Next is to place small gauze at the neck of the ampule and then snap neck of the ampule quickly and firmly away from the hands. Next is to draw up medication quickly and hold ampule upside down or set it on a flat surface. Insert syringe into center of ampule opening and do not allow needle tip to touch the rim of the ampule. Aspirate medication into syringe by gently pulling back the plunger and then keep needle tip under the surface of liquid. Tip ampule to bring all fluid within the reach of the needle. And then, if air bubbles are aspirated, do not expel air into the ampule. To expel air bubbles, remove needle from the ampule, which I already did, and then hold syringe with the needle pointing up. Top syringe on the side to cause the bubbles to go upward to the needle, and then draw back slightly on plunger and then push plunger upward to eject air. Do not eject the fluid. If syringe contains excess fluid, use sink for disposal. Hold syringe vertically with needle tip up and slightly towards the sink. Slowly eject the excess of the fluid into the sink and then recheck fluid into sink. Recheck fluid level in syringe by holding it vertically. And then next is to cover with its safety cap and then change needle or syringe if you suspect the medication is on the needle shelf. So for me, I will be changing my needle tip to new one. So that's for the ampule medication. For vial containing a solution, remove of the covering top of the unused vial to expose sterile rubber seal, keeping rubber seal sterile. And if a multi-dose vial that has been used before is being used again, firmly firmly wipe the surface of the rubber seal with alcohol swab and allow it to dry. Next is to pick up the syringe and remove the needle of the cup. Pull back the plunger to draw amount of air into the syringe equivalent to volume of the medication to be aspirated from the vial. And then with a vial on flat surface, insert tip of the needle with beveled tip entering first through center of the rubber seal, and then apply pressure of the tip during the insertion. Next is to inject air into the vial air space, holding onto the plunger. Hold plunger with firm pressure. Plunger may be forced backward by air pressure within the vial. Next is to invert vial while keeping firm hold syringe and plunger. Hold vial between thumb and the middle fingers of the non-dominant hand. Press the end of the syringe barrel into the plunger with thumb and forefinger of dominant hand to counteract pressure in vial. Keep the tip of the needle between fluid level. Allow air pressure from the vial to fill syringe gradually with medication. If necessary, pull back slightly on plunger to obtain correct amount of solution. When desired amount has been obtained, position needle into vial's airspace. Tap needle of the syringe barrel carefully to dislodge the air bubbles. Effect any air remaining at the top of the syringe into vial, and then remove needle from vial by pulling back the barrel of the syringe. Hold the syringe at eye level at 90-degree angle to ensure correct volume and absence of air bubbles. Remove any remaining air bubbles by tapping the barrel to dislodge any air bubbles. Drawing back slightly on plunger, then push plunger upward to eject air. Do not eject fluid. If medication is to be injected into client's tissue, change needle into appropriate gauge and length according to the route medication. For multi-dose vial, make label that includes date of mixing, concentration of medication per milliliter, and nurse's initial. So I will be putting back the cup and I will be changing the needle into a new one. For vial containing a powder, remove cup covering vial of powdered medication and cup covering the vial of proper diluent. I will be placing it here. Next is to pick up syringe and remove needle cup, pull back the plunger. Pull back the plunger to draw amount of air into the syringe equivalent to the volume of medication to be aspirated from the vial. So I will be with vial on flat surface, insert tip of the needle of the bevel tip entering the first true center of the rubber seal. Apply pressure of the tip of the needle during the insertion. Next is to inject air into the vial's airspace, holding on the plunger. Hold plunger with firm pressure. Plunger may be forced backward by air pressure within the vial. Invert vial while keeping firm hold of the syringe and plunger. Hold vial between the thumb and middle finger of non-dominant hand and grasp the end of the syringe barrel into the plunger with thumb and forefinger of dominant hand to counteract pressure in the vial. Next is to keep tip of needle below fluid level and then allow air pressure from the vial to fill the syringe gradually with medication. If necessary, pull back slightly on plunger to obtain correct amount of the solution. So 2 ml. When desired amount has been obtained, position needle into vial's airspace, um, top side of the syringe barrel carefully to dislodge any air bubbles. Eject air remaining at the top of the syringe into the vial. Next is to remove needle from the vial by pulling back the barrel of the syringe. Next is to insert tip of the needle through the center of the rubber seal of the vial powdered medication. Inject diluent into the vial and then remove needle. And then mix medication thoroughly, roll in palms. Do not shake. Reconstituted medication in vial is ready to be drawn into new syringe. Read label carefully to determine dose after reconstitution. So I will be using the syringe. Next is to dispose of soiled supplies, place broken ampule and or used vials and used needle in a puncture-proof and leak-proof container, which I have here. And then clean work area and wash hands.